Hi, my name is Jade Curtis, your host for BlackDoctor.org's newest video series, The Pulse. I'm here with Dr. Strickland. Do you mind telling us a little bit about yourself?
Yeah, so I am Dr. Desiree Strickland. I have a doctorate in public health from Florida A&M University.
Okay, HBCU on the Tuskegee. Woo woo.
Let's go. So I'm also the founder of Strickland Health Consulting and the founder of the Public Health Club. So I have my public health consulting business where I do a lot of health equity focused work, so training, workforce development type things. Then I also founded the Public Health Club. So we're an online community of over 700 public health professionals who really are focused on advancing their career and then building their entrepreneurial endeavors.
Absolutely. I love that. So how did you start that program and what motivated you? What did you see was missing that made you say, hey, we need to do this?
Yeah, so basically so many people I talk to say, oh, I'm leaving public health because I'm not making any money in public health.
Okay.
Or, I'm doing this work and I'm passionate about it and I love what I do, but it's not paying the bills, right? So I decided to, when I was, I finished my doctorate, I said I wanted to start a consulting business because I seen so many people. We would have these consultants come in and they would literally do work for like 3 months for like 5 to 10 hours a week and they would make my whole salary.
Oh, wow.
And I'm like, I can do that.
Yeah.
So that's when I was just like, you know what? I'm going to start my consulting business. So I started. I was able to, in the first year of me starting, I made like $135,000 like on the side of my full-time job.
Wow.
And so I was like, you know what? Everybody needs to know how to do this. Like, so why aren't we doing this? And so that's when I decided to create the Public Health Club because I was like, you know what? No, like it's so much burnout in this field and so many people doing all of this amazing work, but we deserve to get paid for our work. So that was really the main reason. And it's blossomed, it's grown. So many people have like built their businesses and landed contracts and it's just doing amazing.
That's amazing. I really appreciate people who kind of go out of their way to make sure other people get opportunities too.
Oh yeah.
Because let's admit, there's enough for us, right?
Oh, for sure.
There's too much opportunity out there to gatekeep. Okay, yeah. So I love that. So tell me again, how many members are in this organization?
Over 700.
You are killing it. And so are there any focus areas? Like, do you guys get together and do maybe some things together to kind of uplift what you're doing? Or tell me about some of the programs that are a part of your
Yeah, so we have tons of workshops. Every month we have various workshops. So focus in on whether it's entrepreneurship or just career advancement. So I like to make sure my workshops, we focus in on like a lot of the non-traditional public health careers. So we've had some like focus in the biopharmaceutical industry, in the tech space. We actually had someone who is building a public health tech startup.
Wow.
And she came and she talked about how she built her startup, how she's raising funds. We had someone that owns a venture capital firm come in and talk with us about all of that. And then also just kind of people who are just doing amazing things in their careers to just talk about the good that they're doing, just talk about really just how they got to where they are and just give that inspiration to the community.
Absolutely. And that's actually what I want to hear from you. That's exactly what I was going to ask. Like, for someone who wants to do something similar to you, what are some advice or steps or even just like a strong quote that maybe changed your life that you could share with others?
Yeah. So honestly, I have this one quote that I tell everyone, and I'm like, there are people with half your talent making serious waves while you're still waiting to feel ready.
I know that's right.
And that quote was what made me even start my business because I was always questioning myself, even after having a doctorate, having like 10 years of work experience. I'm like, am I still good enough to build this business? Am I still like, should I still do it?
Yeah.
And then I was like, looking at other people, I'm doing it. And I'm like, no, like I could do this job way better than them. So I had to kind of keep telling myself, I actually saved that as my screensaver when I was building my business so I could go back to it and look at it all the time. So it kept me motivated. And I always tell people that like there are people with half your talent that are doing this and they're like doing it greatly. Imagine what you can do.
Oh, I love that. And I totally agree with the screensaver thing. Like, because we're already on our phones all the time anyway. If you just have that one thing that motivates you right there all the time, it'll change your life. Change your life in a year. Change your life in 30 days.
Oh yeah.
Absolutely. Okay. What else? Okay, so for your program, let's talk a little bit more about some of your members, some of the things that they're doing, and maybe how you're uplifting them. Are you guys on socials or
Yeah. So at the Public Health Club. So just on Instagram and on LinkedIn, the Public Health Club. And then my Instagram, Desiree Courtney J. But we do a lot as far as like our members are doing just amazing things. Like a lot of them, like I said, they're building businesses that they never thought they would start. Someone told me the other day, like, she never thought in a million years that she could potentially be a millionaire. But like now, because like she's been able to secure just being in the club, like for less than a year, she's been able to make over $100,000 on the side of her job through these contracts, through just doing this work like part-time. And she was just like, now like I'm actually considering like talking to like a wealth manager because I'm like, I got all this money coming in and then someone else told me, she was just like, her husband got laid off and she was just like, wondering like, how are they going to pay the bills? And she started consulting and bringing in contracts and money on the side. And it's like, now that's not a worry anymore.
Yeah.
And so, you know, it's just little like stories like that we get all the time. And even people on the career side, like my big thing is I'm like, you know, there are so many jobs out there that need people with public health skills, but it doesn't necessarily say public health on it, right?
Yeah.
Like it may say something like, you know, insight analytics or like just something like real world evidence or real world research, but that is literally public health. And it's just a matter of us knowing how to take our skills and translate them into, you know, what the recruiter or the organization is looking for.
1000%. And I think when it comes to a term like public health, I know like when I was in college, a lot of people were into it, but some of my classmates didn't know what that is. To be honest, I didn't know what that was in college.
Oh, yeah.
So what are some of the things that you guys actually focus on in that space as a public health professional?
Yeah, so it varies so much. And so that's why I feel like, you know, a lot of times you ask one public health person what they do, you're going to get a very different person than you ask somebody else, because it's not just one thing. So, I mean, like the way I've always learned what like public health, and I'm also an adjunct professor. So what I tell like my students who are just getting into it, I'm like, you know, if you go to the doctor, like you go to the medical doctor, like you see a doctor, they're your doctor for just individual one-on-one. Like public health people, like we're doctors literally for just hundreds of people at one time, basically. And we're of course focusing on prevention. And so that is just, you know, one of the things I'm like, that's what attracted me to the field. Like anyways, like I feel like I can make a difference on like a bigger scale than just being one-on-one as a physician. So I think that, but then also like, you know, there are public health people that are doing research, that are, you know, just kind of researching vaccines and doing all of these different things. There are public health people that are leading community projects and, you know, empowering community, going out, getting community data, or just leading communities, taking action on different things. And, you know, there are public health people that are building technology platforms, that are working in hospitals, that are working just literally everywhere in a lot of these organizations.
Absolutely. And so for someone who may have heard what you just said and they're like, oh, I want to do that, how do they get into that?
Yeah. So, I mean, honestly, like I've seen so many people that don't have a public health degree, but they're doing public health work, right?
Okay.
So it's really not a matter of like, oh, you know, what degree do you have? It's more so like, you know, what do you actually do? What skills do you actually have that you bring or that you want to do? And I think that like, you know, within public health, like I feel like in order to like really advance your career, like in traditional public health sense, you do need like a master's in public health at least. So I would say, you know, kind of start there with looking into public health programs. Maybe there's also a public health certification. So the CPH, that's something that if you don't have a public health degree, you could look into getting a certification in public health. So really kind of learn the basics and fundamentals, but really you just start. One of the common trends that I've seen is like a bunch of people who are building these like public health tech startups. They don't have public health backgrounds at all. They had a passion for something. And even one of the sessions that I was in here, this woman, she talked about how she has a journal. She's a journalist. That's her background, but she had a very, you know, interesting birth experience. So she decided to create this app where, you know, people could leave reviews on hospitals and on their birthing experience.
Wow.
And she's like involving public health students in that. And they're going out in the community and collecting data from community members. And so it's like, you know, you really just got to have a passion for this work. And then of course, like collaborate with the experts. So just figure out what you're passionate about and what you want to do and then go from there.
Absolutely. I love that. I love that. And I can hear the passion coming out of you. I can tell like this is your thing. I love that. So if there was one thing following this interview that you really wanted people to walk away with, what would that be?
I would say that people should get into community. Like find people who are wanting to do similar things as you, who are, you know, wanting to be ambitious and to do all the things and to go for the goals, because, you know, you are the sum of the people who you hang around with. So one of the major reasons I even started the Public Health Club was because I didn't have many entrepreneurs that were around me that were doing these things, or many people in public health who could see like, okay, you can have career advancement, you can have growth. It's not just like, you know, just a job at CDC or a job at a health department. Like there are so many things that you can do with your degree. And I think that a lot of times we're just not exposed to those people who are doing all of these different things, and those people who are building businesses and they're bringing in money. They're making like, you know, multiple six figures like every year. And that's like nothing to them. Like they're trying to get to $1 million or they're trying to get to multi-million.
Exactly.
Like, you know, so you got to be, you know, stay in those circles and get into that community. I think that that's like one of the biggest benefits that I've had throughout my career.
Absolutely. Well, I want to thank you so much for joining us on The Pulse. This is going to be such a great episode. I'm so looking forward forward to watching this. But if there is anything else you guys need, share your social medias with us. Where can we find you?
So on Instagram, I am Desiree Courtney J. And then on Instagram as well, the Public Health Club. And you can go to publichealthclub.com and check out and learn more about the Public Health Club. I also have a podcast called The Dr. Des Show.
I know that's right.
Yes.
Okay.
Yeah. So I talk about all of those things as far as like career, entrepreneurship, and just life in general, building a business, having a family, and just doing all the things.
I love that. Well, thank you again for joining us on The Pulse, and we'll see you guys soon.